uterus is made up of a significant amount of smooth muscle. Smooth muscle contraction plays an important role in labor and delivery. During a normal pregnancy, the development of the offspring follows a series of chronological events that must occur before a happy and healthy baby can be born, to the delight of their family. The time between conception and birth typically takes about 8 to 9 months. If this timeline is prematurely interrupted, it is known as a preterm birth and can potentially have detrimental effects on the health of the baby. This can sometimes occur as a result of smoking, lack of prenatal care, or birth defects. Approximately 75% of newborn deaths result from the dangers that can be caused by premature delivery. Preventing such cases can all come down to preventing the contraction of uterine smooth muscle. In this experiment, we tested 3 drugs that could potentially help prevent the risk of preterm delivery. Smooth muscle contraction occurs when a depolarization event at the membrane causes the activation of voltage-gated calcium channels. These channels, called L-type calcium channels, or LTCC for short, cause an influx of calcium into the muscle cell. Within the cell, 4 calcium ions bind to form a complex with calmodulin. Calmodulin calcium complex then goes on to activate myosin light chain kinase, or MLCK. Myosin light chain kinase phosphorylates myosin heads, thereby activating their ATPases and enabling their association with actin filaments. The result is the generation of cross bridges that increase the active tension of the muscle. When this tension exceeds a certain point, the muscle contracts. While skeletal muscle contractions occur via motor neuron innervation and signals from the brain, smooth muscle of the uterus actually contracts spontaneously via slow-wave depolarization.
The first drug that was tested was lidocaine. Lidocaine is a drug typically used as an anesthetic during medical procedures. As always, calcium enters through LTCCs. Voltage-gated sodium channels are also present in the membrane and aid in its spontaneous depolarization. Lidocaine blocks these sodium channels, thereby inhibiting sodium's entrance into the cell. This affects the concentration of calcium entering the cell because of a decrease in overall depolarization of the cell. This decreases the amount of calcium entering the cell, which means less calcium calmodulin complexes. This causes decreased contraction strength and decreased contraction frequency.
Sodium nitroprusside was the second drug tested. It is used as a blood pressure medication and is particularly useful for hypertension. Sodium nitroprusside works by releasing nitric oxide. This gas is able to diffuse across the membrane of the smooth muscle. It binds to guanylate cyclase. GC converts GTP to cGMP, which in turn activates protein kinase G. PKG is then able to go on and activate the myosin light chain phosphatase. MLCP dephosphorylates the myosin heads, thereby decreasing the contraction rates, size, and duration, as well as frequency.
Verapamil was the final drug tested. It is a potent calcium channel blocker that is commonly used to treat hypertension and the diseases associated with it. Verapamil binds to a drug-sensitive receptor adjacent to the LTCC and causes its blockage by steric interference of the channel. The LTCC is no longer able to be activated via depolarization as a result of this interference, thereby affecting the calcium influx into the cell. Less calcium in the cell results in decreased rate of binding to calmodulin. Without the calmodulin calcium complex, myosin light chain kinase is not activated, thereby decreasing the phosphorylation of the myosin heads. Predictably, this results in decreased contraction size, frequency, and duration. In the case of verapamil, its addition significantly alters the concentration of calcium in the cell to the point of complete inhibition of the smooth muscle contraction. This results in total relaxation of the uterine muscle.
Overall, based on our findings, verapamil would be the most effective choice for preventing smooth muscle contractions, thereby stopping preterm births and improving delivery survival rates.